Pain management, 8066. Protocol. Every patient deserves to have their pain managed. Not all painful conditions require advanced life support intervention. Basic life support pain management methods, reassurance, adjusting the position of comfort, ice or heat, and gentle transport can be considered before deciding to treat with analgesic medication. Note, analgesic medication should be considered in all patients complaining of pain. With the exception of ketamine and acetaminophen, analgesics should be avoided if the patient's systolic blood pressure is less than 90, respiratory rate is less than or equal to 10 breaths per minute, and or decreased sensorium or suspicion of traumatic brain injury. BLS. 1. Assess and support ABCs as needed. 2. Supplemental O2 as necessary to maintain SpO2 greater than or equal to 94%. Use the lowest concentration and flow rate of O2 as possible. Assess and treat as appropriate for underlying cause. 3. Transport. ALS. Advanced airway adjuncts as needed. 2. Cardiac and SpO2 monitoring. 3. Initiate vascular access. 4. Document the pain scale, sample scale attached below, with an initial assessment / vital signs after each administration of medication and after all procedures. 5. Pain medications should be titrated to relief if the pain is not effectively managed with BLS pain management methods. A. Acetaminophen for patients with mild to moderate pain. 1,000 milligrams IV-IO infusion over 15 minutes. 1,000 milligrams PO. Do not repeat. Ketorolac for patients with mild to moderate pain. 15 milligrams slow IV-IO push or 30 milligrams IM. Do not repeat. C. Fentanyl citrate for patients with moderate to severe pain. 1 microgram per kilogram. Maximum single dose of 100 micrograms. Slow IV, IO, or IN every 5 minutes. Maximum cumulative dose of 3 micrograms per kilogram, 300 micrograms total. Morphine sulfate if fentanyl is unavailable. 0.1 milligrams per kilogram, maximum single dose of 10 milligrams, slow IV-IO or IN every 5 minutes. A maximum cumulative dose of 0.2 milligrams per kilogram or 20 milligrams. E. Ketamine for patients with moderate to severe pain. Mix 0.3 milligrams per kilogram ketamine, maximum single dose equals 30 milligrams, in 50 to 100 cc's normal saline solution or D5W and administer slow IV drip over 10 minutes. If pain remains at or returns to moderate or severe, you may administer a second dose of 0.3 milligrams per kilogram ketamine, max dose equals 30 milligrams, in 50 to 100 cc's normal saline or D5W and administer slow IV drip over 10 minutes. Precautions / considerations. Number 1, check the patient's allergies before administering any medication. 2, ketamine should be avoided in the following patients. 1, chest pain of suspected cardiac origin. 2, pregnancy. Ketorolac should be avoided in the following patients. There are 10. 1, active bleeding. 2, active wheezing. 3, less than 4 years old or greater than 65 years old. 4, allergy to NSAIDs or non-steroidal anti-inflammatory agents. 5, current anticoagulation therapy. 6, head or multi-system trauma. 7, history of pelvic ulcer disease or upper GI bleeding. 8, history of renal disease or kidney transplant. 9, known or suspected pregnancy. 10, suspected sepsis or septic shock. Okay. 0 to 10 pain scale. Minor, able to adapt to pain. 1 would be very mild. 2, discomforting. 3, tolerable. Moderate, interferes with many activities. 4, distressing. 5, very distressing. 6, intense. Severe, patient is disabled and unable to function independently. 7, very intense. 8, utterly horrible. 9, excruciating, unbearable. 10, unmanageable, unspeakable. Then we also have the Wong-Baker FACES pain rating scale. Goes from 0, 2, 4, 6, 8 to 10. And that's the end of pain management.